Hi, I'm Jana, and I'd like to go over your post-op instructions for the next week or two. And you'll be going home with your post-op bag, and we'll have all the things you need to take care of your newly transplanted grafts after your FUE procedure. So the first thing that we would like you to do is use of the liposomal ATP spray. So what you're going to do for this, for the first 48 hours, is to spray the recipient area. Give your recipient area of your head a fine mist, like this, every half hour. If you can keep the bottle cool, that's optimal, but if you can't, it's still great. It does help you get rid of the redness sooner and help you with the recipient area, have that part heal a lot faster. So please do use it, and make sure you use it for the first 48 hours especially. If you still have some left, you can still spray 4 or 5 times throughout the day until it's gone. But like I said, the first 48 hours is the most critical. The donor area you don't need to worry about with the spray. You're going to be putting on bacitracin ointment. So put that on all through the back after your shampoos. We're going to put it on for you before you leave at the end of the day, so you don't have to worry about that when you get back to your home or to the hotel. But after the next day, if you come in for a shampoo, we will put it on for you, but all your shampoos after that, you'll be putting the bacitracin on in the donor, and then the spray for the first 48 hours in the recipient area. Cleaning and shampooing after your FUE procedure. We would like you to use a cup or a bowl into the shower with you and fill it with lukewarm water. We just don't want it to be real hot. And then just gently pour on top of your head. And then take the shampoo and emulsify it in your hands first. Take the suds and gently pat it in the transplanted area, wherever you have the transplants. And then the back, you can just use your head and use the shower water and let the water run down on the back of your head, and use the shampoo and just massage the area to keep it nice and clean, and then just rinse off again with the shower water.
Great.
Okay, the next thing on the list is rogaine foam. Many patients use the rogaine foam before surgery, and we do ask them to stop during the surgery for a couple of weeks. If you are going to start on the rogaine foam again, we ask that you wait 2 weeks after surgery, between 2 to 3 weeks, so that it doesn't irritate your skin. Next, we'll touch upon exercise and activity. With the FUE procedure, we don't have to worry about the donor scar. So you can resume your normal activity after 7 days. The first 5 days to 7 days, we want you to be really careful because we don't want you to knock out any grafts or getting a lot of sweat on there. We want you to keep it nice and clean, so refrain from your normal exercise routine until a week after surgery. Okay, next on the post-op instructions is hair coloring. You do not want to hair color after surgery, so if you can do that prior to surgery, that's best. But if you're used to doing hair coloring, do it 2 months after surgery so that it doesn't hurt your grafts that were just implanted. Okay, next I'd like to discuss attire after surgery. We would like you to wear a button-down shirt so that you don't accidentally pull out any grafts. So for the first 3-4 days, we'd like you to wear a button-down shirt. The other thing is to wear a hat. If you're going to be out in the sun, or if you like to cover up the work, for the first week, we'd like you to wear a baseball hat or like a surgical cap. Okay, like this, and I will demonstrate how to wear a ball cap. We would like you to take care of the bill of the cap first. So you want to hold this down and then gently bring back the back so that it's laying on the head without pulling any grafts out. And then to remove that hat, we'd like you to hang on to the bill again and then pull up so that you take the back off first and then take the hat off thoroughly. Okay, this time I'd like to cover bleeding, just in case you happen to bleed slightly overnight. And it's not uncommon, so don't worry to bleed just a little bit. So you will, in your to-go home bag, you'll have a couple pillowcases and some sterile gauze. So if you notice that you're bleeding slightly in the recipient area, take a couple gauze out, fold it in half, put it right on the spot that's bleeding. Put an even pressure on there. We don't want you to use one finger and poke any other grafts surrounding that bleeding area. So just hold a light pressure for about a minute or two and the bleeding should stop. In the donor areas, hold the pressure for a good 5-10 minutes. If you continue to bleed and you notice that it's still bleeding after 5-10 minutes, call the patient care line. If you can't get a hold of anyone there, probably call the emergency. But I want you. Okay, next we're going to cover swelling. In your to-go home bag, you'll have a couple ice packs, and we would like you to put them right away into your freezer if you have one. If you're staying at a hotel, put it in the ice bucket. And we do give you 2 so that you can alternate between the 2. And what you do is in the evening of the surgery, when you're home or at the hotel, take the ice pack, and you don't want to put it on your recipient area, but just on the forehead. And note that you're going to need the ice pack for the first 3 days, but if you swell, it's not going to show up for 72 hours. So just because the next day you don't see any swelling, it doesn't mean that you're out of the woods. Continue to ice 4 or 5 times throughout the next 3 days after surgery, and you'll minimize your... Okay, next is swimming in sun. We would like you to avoid swimming in swimming pools or the ocean for the next 10 days. Also, the sun, you do not want to get your recipient area sunburned, so wear a ball cap, or if you need to spray a little bit of suntan lotion, you can do that, but avoid getting it sunburned. The next is alcohol. Please avoid drinking any alcohol, especially the first night after surgery, because you're going to be on pain meds, which is a mild narcotic, but we do not want you to mix the two. So avoid, especially the first night. Next is cigarette smoking. There are a lot of studies that show that cigarettes is harmful for wound healing. So if you can refrain from smoking at all, that's great. But if you are a regular smoker, if you can cut it down, especially for the first couple of months, that's best. But if you can cut it out altogether, obviously that would be best for you and the grafts.
Hi, I'm Dr. Joe, and I'd like to go over a few more things before we let you go. The first of them is folliculitis. Now, most patients do get a little bit of this folliculitis, and it can occur anywhere from 2 weeks up to 6 months even. And basically what it is a little bit of irritation in the recipient area, which can cause a ingrown hair, and you can develop a pimple-like lesion that can sometimes be a little tender. Most of the times what we recommend first off is to make sure you're cleaning your hair with shampoo on a daily basis. This will help prevent a lot of these. Also, if you are having a few of these pimple-like lesions that are tender, you can try some warm compresses for a few days to try to alleviate that. And you can also add a little bit of antibiotic ointment to any of the worst offending lesions. Now, if you do see that they're not really going away, please give us a call, and we can always have you come on in so we can take a look. We may even decide to call in a prescription for you if we find that that's necessary. Now, we have in your to-go bag, we have given you some prescription medications called tramadol, and you can take these for any types of pain that you are having during the next few days. A lot of patients decide to take this at bedtime to help them sleep. But for the most part, we advise you to not use any alcohol or to drive while using this medication. Much more common medication to take for the next few days would be extra-strength Tylenol or ibuprofen, as these medications do help quite a bit, and you can use them during the day or at work. Now finally, in your to-go handout, which contains all the information that we went over with you, there is a list of numbers that you can call if you have questions. The patient care line is the first number you'd like to try. There's also the number of your physician that you worked with, and we'll be happy to answer any questions that you might have. Have a great day. Thank you.